All right, we're going to go ahead and get started. So welcome everyone to the Coordinated Public Transit Human Services Transportation Plan Workshop, known simply as the Coordinated Plan. My name is Kelly Richard, and I am the Transportation Planner for Durham Chapel Hill Carrboro Metropolitan Planning Organization, also known as DCHC-MPO. It looks like everybody currently joining is mostly already familiar a little bit with this plan, but we're going to go through just some overview and everything before we get into more of the logistics of the workshop. So I have provided a link to today's workshop agenda for anyone who would like to follow along. It is in the chat. The agenda has some information on funding, some common definitions, and on the second page, there are also some details on previously funded projects through the coordinated plan, as well as some feedback that was provided from the last update from this plan in 2019. I just want to do a quick check-in. Can everybody hear me? You could just give me a thumbs up or something.
Yeah, we can hear you, Kelly.
Okay, awesome. Thank you. So this workshop is expected to take about 2 hours, and we have scheduled about 2.5 hours just in case there is extensive discussion. We'll also have a short break about halfway through the workshop. This workshop is intended for those who are involved in transportation, as well as human transit agencies who provide human services, and local residents who wish to learn more about mobility options and provide feedback. So to start us off, I put something in the chat. It is just asking you to write your name, your title, where you work or who you're representing, or if you can just put if you are a resident, that would be extremely helpful for us to know who is in the room with us today. Like I said, I think most of you are members or otherwise we've met before, but just also in case other people show up later on, that we have everybody's information. And so this meeting is also already being recorded for future viewing, so anybody who wasn't able to attend today can see this recording later. There's also closed captioning that is available. However, you do need to make sure that the captions are enabled on your own computer. So there's a little graphic on the screen that just shows you where you have to go. But at the bottom of your screen, it says more with 3 dots. You'd have to go in there, go to captions, and then say show captions so that you can see them at the bottom of your screen. I am asking that everybody keep their video off when they're not speaking. Please raise your hand if you do have a question, just so that we can make sure that we can run this smoothly. We are planning to stop at regular intervals for questions, but you can also always ask questions at any time during this workshop by adding them to the chat. And so we are going to have a series of poll questions today to learn more about who is participating and your interest in this workshop. And so I have a test question that I'm going to throw out to everybody. I'll just give you guys a minute to answer this question if you can. And give a couple more seconds. So, and full. And so I'll be sharing the results so everybody also can see those results. But thank you. A lot of people like polar bears, so that's great. We have one at the local zoo, so that's awesome. We are going to do another poll question. We have a couple coming right now. So we're just looking to see where everybody is joining from or where you call home. Give you a few more seconds. About one more person. And I'm going to close the poll. So most everybody is from the city of Durham. We have some town of Carborough. Thank you guys for coming. Also looks like, hopefully you can see the whole thing now. And other, so good. That's great, thank you. We have another question for you. I promise there aren't too many of these, but they're important to us. We have just one more after this, and then we'll go more into some background on the plan. I'll give you guys about 10 more seconds. Awesome. And so it looks like a lot of people are pretty familiar with this plan. We have a few that are maybe not as familiar. So we will be going over everything in detail. So hopefully, if you already are familiar, you learn a little bit of something, but also you can provide feedback on what things look like in your community based on what you're seeing. And the last question before we move on. We're just looking at how familiar you are with the role of DCHC MPO or the Durham Chapel Hill Carborough Metropolitan Planning Organization in the region, what we do. And I'll give you guys another 10 seconds or so. Okay, and we will end poll. And again, very familiar, so great feedback. Thank you guys. So we're going to start with going over the background and overview of the plan. For those who are more familiar with this, there are always details that change over time. So we'll go over how things currently look compared to how the previous plan was written and things that were written in there. So the coordinated plan, which we're discussing today, is specific to the DCHC MPO area, this specific coordinated plan, which again is the Durham Chapel Hill Carborough Metropolitan Planning Organization. We represent the urban areas in the Western Triangle area, which includes all of Durham County and portions of Orange and Chatham County. And we're responsible for transportation planning in this area. This map is being used to show what coordinated planning looks like outside of those boundaries, such as our neighboring Metropolitan Planning Organization, the capital area MPO known as CAMPO, as well as coordinated planning that happens in the rural areas, which happens through a collaborative effort with the rural planning organizations, also called RPOs, and the North Carolina Department of Transportation, known as NCDOT. These rural plans were recently taken over by the state in a way that they are consolidating all those rural plans into one larger document rather than all of the rural planning organizations doing them together. But it's important to know that there are many coordinated plans that happen throughout the state, and it's important to be looking at all of those and understanding how each area has a different set of localized priorities, but understanding what those relationships look like across boundaries. So what is the coordinated plan? The intent of this plan is to improve mobility of individuals by removing barriers to transportation and expanding transportation options. So this plan looks specifically at the needs of those who are considered transportation disadvantaged, which are older adults, those considered to have small incomes, and those with disabilities. What we find in transportation planning is that when you plan for these communities, everyone benefits. And so we update this plan every 4 to 5 years. The plan must be updated every 5, but you can update it in less time than that. And you have to do that to make sure you can continue receiving specific funding. And that funding in this case is Section 5310 funding that goes towards mobility of those transportation disadvantaged groups. And the DCHC MPO area receives around $275,000 a year in this funding. So a good transportation network has a variety of different services that are available for the different needs of the community. When it comes to public transit, there are 3 main types that you may be familiar with. So there's fixed route service that operates on a predetermined route according to a predetermined schedule. For example, you can look at the schedule online and you wouldn't expect for it to vary on a day-to-day basis, except in rare circumstances like holidays. If there is a fixed route, you also need to have ADA complementary paratransit. ADA is Americans with Disabilities Act, and that paratransit service must exist within the 3/4 mile radius of the route service that's provided. Commuter buses, however, those operate only in the mornings and evenings, and those are excluded from needing to have ADA complementary paratransit legally. But the third common type of transit service are demand response services. And so those tend to fill in the gaps where some of the fixed route or ADA complementary paratransit does not get to. So much like a taxi, Uber, or Lyft, these services do not follow a specific route, but they are typically restricted to certain service areas or certain groups of individuals. So for example, somebody who is older might be able to take the service. It wouldn't necessarily be provided to somebody else, or Medicaid related or something like that. Transportation is a key factor in being able to access human services. So some examples of human services include senior services, such as accessing medical appointments or a local senior center. You also have disability services, which means you need to access employment or education activities. You might also have social services that you need to access, which help with housing or food. So to remove potential access barriers and not being able to access transportation, sometimes human service agencies may have their own vehicles that they will help transport their clients in to get to and from those appointments or services. You might also have the opportunity to buy some services through your local transit provider, where you help pay for that service by giving a certain amount of funds for those trips because somebody else owns those buses. You might also already have existing transit access in that area, so you don't have to worry about it. But there are some cases where there may not be a good solution yet in place. When our plan was last updated, the following outcomes represent what was talked about in those workshops that were held about 5 years ago. On the back of the agenda or the second page, there's a little bit more information on each of these items and what was discussed. But the 5 major areas include a coordination mobility hub for human services and public transportation, just helping better collaborate over mobility. And other items were expanded transportation services, expanded education services, so letting people know how to take these services, opportunities for improving the application process when it comes to accessing these services. For example, when you have a disability and you need to access some transportation services, but you need to put in an application, how does that application get to the right parties? Do you know who it's supposed to go to? And things like that. You also have bus stop access improvements on here. So I'll go over some of these items and different projects that have actually gone to help some of these recommended areas of improvement since the last time we updated this plan. But that'll come later in this presentation. As was mentioned before, one use of this plan is to specify projects that can be funded with a particular fund source, that being Section 5310 funds, which again, these funds are used to enhance the mobility of our transportation disadvantaged communities. So there are some rules as to how this funding can be used, but projects associated with this funding include wheelchair lifts, ramps, and securement devices, travel training so that people can get comfortable riding the transit system, improvements to signage or information so that they can be confident they know they're at the right place and they know which service they're going to be taking. But there's a handful of other things that that can be funded with 5310 funds. So who is eligible to apply for these funds? So it's important to know that to apply, you must be either a private nonprofit, a state or local government, or an operator of public transit. However, that doesn't mean that even if you aren't considered eligible, your feedback wouldn't be useful. There are ways that partnerships can happen and community feedback is necessary in order to get these services implemented at some point in time, whether or not that's now or sometime in the future. Other things to keep in mind are that this funding does require the recipient to provide funding of their own, known as a local match. You must also adhere to a strict program management plan that we have on our website. I can also provide it later for people who are interested. And funds are not provided up front, but rather they are reimbursed. So you would need to be able to put all that money in, all of your own money in first to be able to get reimbursed on that. And this workshop is the first step in possibly receiving funding through this program and getting those 5310 funds. So feedback from this workshop will be used to draft the plan. The plan will then be released for additional public comment and then adopted. And then after that time, applications for 5310 funding will open. Projects will be recommended and put out for public comment again. And then it is likely that projects will be awarded funding around October. And I know that was a lot of information. This next section will go over existing transit services, followed by a short break before we jump into the more interactive half of our workshop today. So I'm going to stop here for a moment to see if there are any additional questions. I did see Colleen, who put in.
Yeah, we've received a question via Brandy, who is talking with someone on the phone from the senior center, and they wanted to understand, I think you might be talking a little bit about this in the next section, but why doesn't the Easy Rider go to Durham and Raleigh, for example?
Yeah, and we will go over that a little bit in the future, but the Easy Rider is, for anybody who doesn't know, specific to Chapel Hill area. And so a lot of that has to do with funding availability, and also the funding sources that are used sometimes don't allow to go past certain boundaries. So there are other ways to get commuter services or other ways, but that is one of those gaps that we'll be addressing later on in this workshop, actually, as to maybe there's an opportunity for filling in that gap at some point. Are there any other questions?
Thanks, Kelly.
Okay. If there aren't any other questions, we'll go on with the existing transit service overview. And this is definitely the last question of the workshop, but just have this last one for you. And so we're looking at how familiar you are with the current transportation services that are available in the DCHC MPO area. So that includes the Durham County area and the urbanized areas of Orange and Chatham County. I'm going to give everybody about 10 more seconds. Okay, I'm going to end the poll. It looks like there is a good variety. So some people who are slightly familiar, some people who are very familiar. We are going to go over in detail what some of those services are. And also at the end of today's workshop, if you are looking to get any resources on more specifics of time and location, service areas, my contact information is on the agenda, but I'll also provide it at the end of the workshop along with a post-workshop survey, just to make sure we capture all of your feedback and provide you with any resources that would be helpful for you moving forward. But so this is a good representation of the public transportation that exists in our general area. As I mentioned, this is public transportation. It doesn't necessarily include some of those more privatized locations, such as universities in this case, but we have places like Chatham Transit, Chapel Hill Transit, Go Durham, Go Triangle, and Orange County Public Transportation. So transportation coordination is essential when it comes to providing services throughout the region. While funding creates some barriers in terms of where services can operate, there are opportunities to collaborate at every turn. So as you can see on this map, there are several transit providers with similar logos. So of the ones I mentioned before, you also have Go Raleigh, Go Cary, Go Triangle, and Go Durham all together. They have a very similar branding, and that's done to make sure that the regional connections are evident to any riders out there. So the purpose is to make sure that you know you can use those services and they operate fairly similarly. Of course, this doesn't mean that they operate all together necessarily. They still operate in many ways independently, but they do share some elements through transit planning that we'll be going over later as well. But you do have transit that is specific to Chapel Hill. So you have Chapel Hill Transit. You have Orange County Public Transit that operates in some rural, some urban areas, and different funding sources that are used to fund all of those different services. You have Chatham Transit down in Chatham County, and we'll go over a little bit more of what services these are in the next slide. But you also have which is the Piedmont Authority Regional Transportation. And they actually provide a commuter bus that comes from Burlington area down through to Chapel Hill Transit. And they, in general, are trying to provide service for those going to UNC, University of Chapel Hill, but also allows for the opportunities for people to reverse commute or go from Chapel Hill back or up towards the Burlington area. So here's a list of some of those more specific services that are available in for all of the different providers across our general region. So Orange County has access to rural funding in areas outside of urban boundaries. This is not necessarily true of some of the other providers who rely on urban funding. And so there's some reasons for why you might not see a service that goes across certain boundaries just because of some of those fund source mixes, which can cause some issues. But you have some senior shuttles that are available in Chapel Hill and in Durham. These shuttles do operate a little bit differently from each other. The Chapel Hill Transit Senior Shuttle that runs Monday through Friday, it runs on a loop that goes to around 10 different senior center or senior residences every day through that process, whereas the Durham Senior Shuttle has a few different facilities that it visits each day. It brings the people from those facilities to Walmart and back. And so the next day it'll be a few more different facilities that'll do that same process to Walmart and back. And that was done through a partnership with a local group to make sure that seniors are getting their source to fresh food and be getting to those locations. And so there's also Chatham Transit that does in-county demand response service. So that basically means that the person who's taking the service has to pay for their fare based on the number of miles that they're going to be traveling on the service. And you also have other things located in here, such as differences in fares and how fares are charged. I do see a question from Suchi. Are fares coming back in July for Go Durham? So I know that based on how things are right now, yes, fares are going to be coming back in July. However, I know there's also some conversations happening with Durham that might be changing what they were planning on doing. So that's still kind of up in the air, but for the time being, what we know is the expectation should be starting fares in July. So another important thing to know with transit planning is the transit tax in the Greater Triangle region. So the Triangle region has 3 different transit plans that use transit tax funds to be put into different projects. And so you have one in Durham County, one in Orange County, and one in Wake County. There are 2 of those 3 that are in the DCH-CMPO area, and those are the Durham and Orange County transit plans. They have short range transit plans as a part of this process. So apart from the long range transit plans that you're seeing on the screen now that go out to around 2040, I believe, they also have short range plans that go out for the next 4 years. And that will tell you what projects are recommended to be funded of all of the possible projects over the next 15, 20 years should be funded in the next 4. And there's also an annual program of projects that receive funding for the next year. And all of this requires public engagement. So apart from this coordinated planning workshop today, there's also opportunities to get involved in the transit planning work that's going on as well. So some of the pieces of the puzzle from the transit plans are some of the things that we're talking about today in the coordinated plan are also benefited in these transit plans. So for example, the Durham County Transit Plan says they plan to have all of their bus stops paved and become ADA accessible paths by 2030. That goes along with the coordinated plan recommendations, which were to improve bus stop access. So that is something that is actively happening on the Durham County side. They also have funding for the senior shuttle, low income fares. They have their Connect demand response service and ADA paratransit. So something that's important to know is when you do increase or change your fixed route, you potentially have to then increase your ADA paratransit because now you've increased your fixed route by a mile. That means you have to increase your paratransit by a mile as well. You also have some things that are added into the Orange County Transit Plan. And some of those things are service expansion for the Easy Rider. So as I mentioned before, the Easy Rider is the Chapel Hills demand response service. In a way, they operate their ADA paratransit and their senior shuttle, known under the umbrella term as the Easy Rider. There's also funding for ADA paratransit expansion, such as with the Durham plan. You also have funding for rural services and, again, like the Durham plan, low-cost fare passes. All things that are helping remove those barriers that are similar to what we're talking about in this coordinated planning process as well. And so to give you an idea of some of the things that have been funded with through this plan specifically since the last plan update, we have things such as the Easy Rider Senior Shuttle that is funded through 5310 funds. You also have the Orange County Steam Mobility Manager and the note below. So that's the Senior Transportation Expansion Assessment and Mobility Management Manager. You also have some ADA bus stop work. So again, going towards those recommendations from the last plan update. You also have expansion of ADA trips. So as a minimum requirement, you are supposed to have ADA paratransit within that 3/4 mile radius of your fixed route. But that is a minimum. So you can always go beyond that. And that is what that funding is being used for. You also have things like county access, so demand response that isn't specific to ADA and isn't specific to just the city. And then there's some administration funds that go to the MPO for oversight of this funding source because it is federal funding. So there needs to be a certain amount of oversight, as I mentioned before, with having a program management plan. And I saw there was a raised hand. I'm not sure if it went down.
Oh, it was me. I was just saying I was the mobility manager.
Oh, yeah. Thank you, Brandy. And so this is a moment where we just wanted to stop and ask if anybody had any thoughts on things we're currently doing well. Things that maybe I haven't mentioned or things you've seen in practice that have been beneficial for the community, maybe since the last plan update, maybe in the past year. If you don't have any comments, that's okay too. But if you do, if you could just raise your hand. Okay, Brandy, you can go ahead.
All right, Ms. Harris, can you talk?
Yes. My name is Sharon. I'm coming to the Carrboro area. I moved here from DC in October. And I just missed 3 doctor's appointments because I was told from the Easy Rider folks that they didn't go to that area. Now, I guess I'm spoiled coming from DC because I literally walked out my front door and got on the subway and went wherever I wanted to go, got on the bus and go wherever I wanted to go. I don't drive anymore for health reasons. And I was born here in DC, in North Carolina, and I'm a little disappointed. I think I made a bad decision about coming home because I'm looking at my calendar now. I'm looking at 3 missed doctor's appointments because I was told by the Easy driver that they didn't go to these areas. in human resources for 46 years in DC. And I told my folks, it's the way you speak to people, especially senior citizens who have done their time, they've worked and they're retired. And if you can't honor them by the way you speak to them, then you need to find another job. And there are several young women and men that I talk to that need to find another job because they don't know how to talk to people. So I don't know if you have control over that, but I can help you recruit. I still know how to recruit. And I didn't come home to be disrespected. I came home to live my life and transition out with the pride that I came to this planet. But like I said, I'm looking at my calendar right now, and I have 3 missed doctor's appointments because the Easy Rider said they didn't go to those locations. So can you give me some feedback?
Thank you,
Yes,
Ms. Harris.
thank you. I'm sorry for those missed appointments. It's definitely very important feedback, and we'll make sure to share it with the transit agencies and let them know how that's impacting the people like you and other residents in the area. I don't necessarily have any direct control over that, but I will make sure that we look at those service areas and see what additional gaps there are. So thank you.
Thank you, Ms. Harris.
I have one follow-up question. If maybe we can connect offline after this meeting too, just to talk about where you're trying to go and make sure that we understand, the coverage areas and the gaps there too. So we can help coordinate better with the transit agencies. Thank you so much for sharing that experience with us.
Right, and I will give you guys her phone number, Ms. Harris, if that's okay.
Yeah.
All right, awesome. Thank you so much.
Thank you.
Does anybody have any other additional thoughts?
This is Shuchi, and I'm just wondering, and this was something that I was meaning to ask, but I was just waiting. I mean, it can easily happen that somebody who lives in the DCHC area may have a doctor or a different, place they need to go to in the Wake County area. So, how well are you coordinating with the Campo on their coordinated plans so that for the residents, it's not an issue? And, they are not told that, oh, that's the Campo area. We don't know what they are doing. So I think it's really important for this area to progress together, that there is some kind of coordination between both the plans. Thank you.
And yeah, thank you, Suchi. That's an important piece. For reference to, we do our longer range overall transportation plan in tandem with Campo. So it's one plan, Capital Area Metropolitan Planning Organization, and the Durham Chapel Hill Carrboro Metropolitan Planning Organization. We are coordinating as well on this specific coordinated plan. And we do have regular meetings. So yeah, thank you, Suchi. That's really important, especially because those boundaries between our areas are pretty much invisible for every reason except for how we receive funding. So it's a very important point.
Thank you.
And does anybody have any additional thoughts at this point in time? We are going to get into the workshop momentarily, but we are planning on taking a short break before we do that if there are no additional questions or comments. And seeing none, let's take a 5-minute break. We'll come back at 1:47. If that's okay, it's not a round number, but 1:47, that would be great. Thank you. Okay, welcome back, everyone. Hopefully everybody is coming on back. We are going to start with more of the interactive session of this workshop. And so we're going to be going through and doing some breakout sessions to have more discussion on some gaps that might exist right now in our current system. So we've already heard a couple today, but to see what other things people are thinking about. So you will be added, so I will add you to a breakout room to discuss in a smaller group. There will be approximately 4 to 5 people per room. I will be providing you focus questions per breakout session, so you know what to talk about in those smaller discussion groups. And so I'll give you 10 minutes to talk about these items amongst yourselves, and then we'll come back together as a group. And so there's going to be 2 of these breakout sessions that we'll be going through. So 10 minutes for the first one, and then the second one will also be 10 minutes of that time to discuss. And I'll also let you know a couple minutes before we come back together as a group. And so one thing I do want to make sure you make note of, if you can, when you do get assigned to a room, it will say room 1, room 2, room 3, room 4, whatever it is. If you could remember which room you were in and assign somebody to talk more on those points, just so we have one person that's leading the discussion from each of those rooms, that would be great. If you have other things to talk about and you are part of one of those different rooms, we also can add that to the discussion after we go through all of those different representatives from each room. And so we will be going through a Zoom whiteboard exercise. So once you come back from those rooms, I'm going to go through and write down all the things that we're talking about. So then we will take that feedback down, identify different strategies on maybe how to lessen the gaps that are existing, and then prioritizing that feedback as well. So the first item we're going to be looking at is identifying transportation needs and gaps in services. And so the focus questions for this, and again, I will add this in the chat for when you go into those smaller group discussions, is what still needs to be addressed since the last plan update. So if you do know that, that's great. If you don't, that's also okay. Are there needs or gaps from the last plans that are still relevant? And so again, that can be found on the back of your agenda and some of those discussions and items. Any new gaps, anything that is a new need. If you don't have background on this, it's also okay to just talk about the things that you do know that are not working. What impacts has COVID had that you've seen in different geographic areas or demographic groups that might be experiencing different challenges? So I'm going to add all of these questions into the chat. And I will be adding you all to different breakout rooms. So just give me one moment.